Hi, everybody. My name is Dr. Shiri, Shinan-Altman. I'm from Bar-Ilan University, the School of Social Work in Israel. And the title of my presentation today is COVID-19 Precautionary Behavior Among Israeli Breast Cancer Patients. Overall, the high transmission of COVID-19, together with medications treatments for the virus, posed serious challenges to control the virus spread. And in order to tackle this problem, health authorities stated that it is highly important to implement non-medical measures such as precautionary behaviors, for example, like washing hands often with soap and avoiding shaking hands. And to achieve the successful implementation of such measures recommended by the health authorities, the willingness of the public to follow the instructions plays an important role. However, it should be noted that it is still a health problem to encourage the public to follow the recommended preventive actions. And professional knowledge indicates that cancer patients are more susceptible to COVID-19 than individuals without cancer. And this is due to these patients' systematic immunosuppressive state caused by the malignancy and anti-cancer treatments, such as chemotherapy or surgery. And in addition, it was found that the COVID-19 mortality rate in breast cancer patients depends more on comorbidities than prior radiation therapy or current anti-cancer treatment. And therefore, these patients need to take additional precautions against the COVID-19 outbreak. Specifically in Israel, the Ministry of Health released updated information for the lay public regarding how to behave during the COVID-19 routine. For example, wearing a face mask when leaving home, practice again, staying 2 meters from other individuals, and avoiding public spaces when having fever or other COVID-19 symptoms. And the assumption is that the relevance of such information is likely to motivate subjects in risky and severe condition to process risk information more systematically and to rely less on superficial regarding COVID-19. And this is especially important for breast cancer patients, as it was found that adherence to control measures is largely affected not only by risk perceptions, but also by correct knowledge about COVID-19. So, in order to examine factors associated with precautionary behavior among breast cancer patients during the COVID-19 outbreak, this study was based on the cognitive model of coping with stressors developed by Lazarus and Folkman. And according to this model, health outcomes of coping with chronic and intense stressors are affected by appraisals of the stressor and coping resources, for example, sense of mastery and social support. And in this study, perceived stressors was conceptualized as perceived threat, as this factor may influence willingness and motivation to adopt health behaviors. In this study, we included 2 coping resources. The first one is sense of mastery, which refers to the perceived control of individuals over the future, the appreciation of cause-effect relationships, and their perceived ability to cope with life stressors. And the second one is an external coping resources, social support, which acts as a facilitator for setting coping strategies through sharing problems and getting helpful suggestions, which help people to face their problems and find constructive problem-solving strategies. And here you can see the study model, which includes knowledge about COVID-19, perceived threat, 2 coping resources, which are sense of mastery and social support, and the outcome variable, which is precautionary behaviors. So the aim of the study is to examine the associations between knowledge about COVID-19, perceived threat, coping resources, and precautionary behavior among Israeli breast cancer patients during the COVID-19 outbreak. And this aim is especially important given that precautionary behaviors are significant in both the spread and control of infectious diseases and in maintaining the health of populations under risk, such as breast cancer patients. So this is a cross-sectional online survey. To minimize personal contact during the outbreak, the questionnaires were administered through the Qualtrics online platform. A total of 153 Israelis visited the online survey between April 5th, 2020 and April 12th, 2020. Inclusion criteria were women who were diagnosed with breast cancer in the last 5 years, aged 18 plus, and Hebrew speakers. And exclusion criteria were responses to the items in a similar pattern or not completing the whole questionnaire. An authorization for the study was obtained from Bar-Ilan University's ethics committee. And here you can see the measures we used. Precautionary behavior was measured with 4 items written by us, the authors, following the precautionary guidelines issued by the Israeli Ministry of Health. Sample items include washing hands with soap and water and avoiding close contact with people with symptoms such as coughing or sneezing. Perceived threat was assessed using 1 item. How likely do you think it is that you will contract COVID-19? Sense of mastery was assessed by a 7-item scale. Social support was assessed by the multidimensional scale of perceived social support. And we also collected data regarding social demographic variables and health information. So, as you can see from this table, participant mean age was 51, mean number of years of education was 15, more than half were married, mean number of children was 1.46, and in the time of conducting the study, about half of participants were isolated as a result of COVID-19. Regarding participants' health characteristics, about half of the participants perceived their health status as moderate. More than half of participants had other chronic diseases, such as hypertension, diabetes, heart disease, or other diseases. Regarding precautionary behavior, most of participants reported that they perform precautionary behavior such as washing hands, avoiding shaking hands, covering mouth and nose when sneezing, and so on. And according to this matrix table, significant positive associations were found between precautionary behavior and knowledge about COVID-19, sense of mastery, and social support. And finally, in a multivariate regression analysis, it was found that after controlling for the background variables, only knowledge about COVID-19 emerges as a significant predictor of precautionary behavior, and this variable explains about 15% of the precautionary behavior variance. So our results suggest that higher percentages of breast cancer patients perform precautionary measures to reduce the risk of having COVID-19. And approximately 95% of respondents said that they would avoid close contact with people with symptoms such as coughing or sneezing. And similar percentage stated that they wash hands often with soap and water or an alcohol-based hand sanitizer, and that they cover their mouth and nose when coughing or sneezing. And the high levels of precautionary measures found in the current study could be due to 2 main reasons, we assume. The first one is that they may be related to the measures the Israeli health authorities has adopted since the outbreak in controlling the transmission of COVID-19, including issuing precautionary guidelines on a daily basis. And such strong measures and the transparency of the media may increase the public's mental resources to maintain their physical health. Another reason may be that cancer patients, and among them breast cancer patients, are at increased risk of contracting the virus. And therefore, it might be that breast cancer patients have taken precaution in implementing the recommendations of the health authorities and did their best to adhere to the various guidelines. In this study, knowledge about COVID-19 has emerged as an important determinant of precautionary actions, and the finding that knowledge about COVID-19 is an important determinant of precautionary actions is significant for those who develop public health messages during crisis situations. And accordingly, health authorities should identify vulnerable populations that may not be literate and target health promotion messages in appropriate methods, which may have a high probability of reaching these populations. We also found that risk threat was not associated with precautionary actions, and the measures of coping resources did not indicate any statistically significant associations with precautionary behaviors. And if risk perception has little effect on precautionary behavior, public health authorities or messages aimed at changing risk perceptions might be non-effective in changing behavior. Nevertheless, the implications seem to be that motivating breast cancer patients to practice proactive behavior works best by increasing their knowledge rather than by concentrating in risk perceptions, but this is clearly an area that needs further empirical examination. This study has limitation. First, we used a correlational design, and thereby it limits our capacity to demonstrate causal relationships. In addition, we have no information if participants received additional information or education regarding precautionary behavior from oncology institutions or healthcare providers. Nevertheless, given the mass media in Israel, we assume that the amount of information these women received was mostly reliant on information provided specifically by Israel's Ministry of Health. So in order to enhance precautionary behavior among breast cancer patients during a virus outbreak, it is recommended to pay close attention to the knowledge about the virus. Evidently, being actively engaged in news information processing and being informed about the COVID-19 pandemic plays an important role in driving breast cancer patients to engage in precautionary behaviors. Thank you so much for listening and for your attention. And for more information, you can email me to this email address. Thank you and have a nice day.